Hi, Dr. Berardi, and another question came in that involves how did I get here, right? So there's lots of people out there that start off life not knowing what they want to do, and then a light bulb goes off and they said, I want to be a plastic surgeon. So how do you get there? So it depends on how early in life, right? There's things to think about. Typically in high school, best step is get good grades, study hard, right? Have a well-rounded life. You have to do well grade-wise, but you have to be involved in extracurricular activities, you have to show leadership and so forth, and this is going to continue on into college, because looking back at applications when I was in residency and we were part of the application process, we wanted to see people that were well-rounded, not only smart, but they did well in school, they did well on their tests, they had a good list of pertinent extracurricular activities, they held leadership positions. So that's things you want to essentially solidify in college. This will be assisted by having a preceptor or a pre-med counselor, right? And pre-med counselor will direct you on your coursework. They'll direct you on what you're supposed to be doing outside of your coursework, which again, it's important that you're well-rounded. Now, I mentioned preceptor earlier. So a preceptor might be a physician in the community that's willing to take in a student so you can actually see what is involved in medicine, right? You see it on TV, however, you don't often see it in a private practice setting and see what the true life of a physician is. Plastic surgery, for instance, you can be a plastic surgeon that's doing strictly reconstructive. You can have plastic surgery that's strictly doing pediatrics, hand surgery, cosmetic surgery, burn surgery. So we kind of cross this whole range of specialties that we can do because it's part of our training. So, but most importantly, one, figure out what it's like to be in a private practice office or maybe even a university setting if you have that opportunity in college. In med school, it's the same. You have to work hard. You have to stay involved in extracurricular activities. You'll have the opportunity to rotate through plastic surgery. Hopefully you'll be able to do this preceptorship in your first couple years as well, because then you're going to have a more of a knowledge base, and you're going to say, is this what I truly want to do? For me, I determined I wanted to go to med school about sophomore year in college, and at that point I was told, get a preceptor, and I was fortunate enough to preceptor with a plastic surgeon in college, and at that point I said, yeah, this is exactly what I do, I love this, it's amazing. And I continued on into med school. So my first years in med school, which in most cases is going to be book work, I preceptored with a plastic surgeon those first 2 years as well. Now the tricky part is your second 2 years, which are going to be your clinical rotations, are going to be through various specialties in medicine. And there I say, keep an open mind, right? I truly tried to find a field other than plastic surgery that I was passionate about, because I didn't want to short myself. And ultimately it came back to, I evaluated everything, I worked hard in all my specialties, still I wanted to be a plastic surgeon. So at that point you're in medical school, you've worked hard all through high school, college, med school, you're applying to residency programs, and with luck and hard work, you're going to get into the program you wish to go to. Take care.